This is the Whole Care Network. Helping you tell your story one podcast at a time. Content presented in the following podcast is for information purposes only. Views and opinions expressed in this podcast are solely those of the host and guest and may not represent the views and opinions of the Whole Care Network. Always consult with your physician for any medical advice, and always consult with your attorney for any legal advice. And thank you for listening to the Whole Care Network.
I wanted the Veterans Program to do three things. First was to honor the sacrifice that the veterans had made. You would think that it's not a big deal, but especially as someone approaches end of life and you start taking stock of what you've done, what sort of impact and what sort of legacy you're leaving behind, being recognized for the sacrifices that you've made is extremely important. It means a great deal to the veteran, and even in many ways more so to the families, that legacy is being left behind.
This is the Heart of Hospice podcast with Helen Bauer. My guests today are talking about their work to meet the special needs of U.S. military veterans at the end of life. Whether you're a family caregiver or an end-of-life professional, the Heart of Hospice is here to enhance your hospice experience by connecting you with information you can use about end-of-life care.
As a caregiver, you want comfort and dignity for your patient and convenience for yourself. The Quick Change Wrap offers all of that with a life-changing way to address male incontinence. It folds around the source of urine and wicks it away, protecting surrounding skin, clothing, and bedding. Use the Quick Change by itself or with an adult diaper for superior protection. A single caregiver can quickly change the wrap with no lifting or turning the patient. 800 hospitals use it. Now you can get it at home. Visit quickchange.com now. This episode of The Heart of Hospice is sponsored by Odonata Care. Odonata's motto is, "Care is treatment." They've made it their mission to transform the end-of-life experience for the patient and caregivers through education and support. With 50 free YouTube videos that teach bedside care and their booklet, The Care Plan, A Path to Comfort for the Hospice Patient, Odonata Care is revolutionizing the hospice experience. Visit thecareplan.net for more information. Now here's today's episode.
I've got a couple of awesome guests today. Carlos Graverin and Eric Jorgensen of Frederick Health Hospice are with me today. They have a special program at Frederick Health Hospice where they are focusing a lot on the needs of U.S. military veterans. There's quite a bit of veteran population there in the area that they serve in Maryland. And Carlos is the executive director for Frederick. It is a nonprofit hospice agency. He's a passionate advocate for hospice and end-of-life care. He is also a very proud U.S. Army veteran. Eric Jorgensen is a veteran liaison with Frederick Health Hospice. It's an unusual position and specific to the needs of their community. Eric was widowed in 2012 and retired from the Navy at the end of that same year. After beating cancer in 2020, Eric decided he wanted to do more for the communities he's most passionate about, those with disabilities and the veteran population. He also has his own company, True North Disability Planning, that provides information and resources for families with kids who have been significantly impacted by their disabilities. So we had a great conversation about their work that they're doing there in their community in Maryland to support not only the veterans, but their families as well, the special needs that their caregivers have and the special needs and the resources that the veterans have. It's a very interesting niche when it comes to hospice care. Of course, all of our patients are unique. right? They're all coming to us with their own legacies and stories and set of symptoms and whatever needs that they have. But veterans have their own unique needs as well. And it depends on where they served and in what era and what their experiences were. So Carlos and Eric are going to be talking about that with me some as well. So here's my conversation with Carlos and Eric of Frederick Health Hospice. Eric and Carlos, welcome to the Heart of Hospice podcast. I'm glad to talk with you guys.
Thank you, Helen. It's great to be here.
Thank you, Helen.
It's good to see you and to talk about the work that you're doing at Frederick Health Hospice. You have some unique programs that you're working these days, and we're going to take a deep dive into that and share this with our listeners. But I want to give them sort of a backdrop and talk about how you guys got started in hospice work. Carlos, you're the executive director at Frederick. How did you get into this work to start with?
I wish I had a really great story to tell you about that, but I've been in healthcare pretty much my entire career. I started out in the pharmaceutical industry and years later moved into the home health industry. And the organization I was with, I won't name them, but they were just horrible. I did not enjoy working for them at all. So I wanted to stay there a reasonable amount of time. So I basically put in 2 years with them. But during my time there, I started looking around for different options. And hospice was something that I found to be interesting. So I sort of jumped at the first opportunity after that 2-year time frame to move to a for-profit, large national for-profit hospice. And that was a great move. What initially started, however, is just another job move, really turned into a passion after my dad contracted cancer. And I was able to accompany him through that journey and learned a great deal from his experience about what to do and what not to do in that hospice process. It's made me extremely passionate. I want to help folks to avoid the mistakes that were made in his case so that they can have a much better outcome than he had.
I think it's such a gift to have a personal hospice experience when you work as a hospice professional. It really teaches you. And there's no shame in not having some big explosive dramatic story to that first job, because my first job wasn't anything, but I needed a full-time job. Eric, how about you? How did you get started?
Similarly unglamorous. I retired from the Navy back in 2012, and I've been self-employed since then. And I have an older son with disabilities, and I was looking for something to get out of the house to give myself some respite, but still do something meaningful. So I found, Frederick Health Hospice was looking for a part-time veteran liaison. I'd never heard of a veteran liaison, but it sounded promising. I went and interviewed, and it's amazing. I really like it. I didn't know there was anything like it out there. And but that's how I ended up joining hospice. I had no clue what hospice did. My impression of hospice was you go there to die. That was really what I thought it was when I went. I'm like, okay.
Yeah, it's very common. Most people think that way. And in fact, if you'd have told me when I graduated from college that I'd be doing this for a living, I would have told you you're crazy.
Oh, same thing for me as a nurse. Yeah. How many people would actually graduate from college knowing I want to work with people who are dying?
Very, very few.
Yeah, I wouldn't say there are a whole lot. So Eric, you brought up the job that you're working, and that's really where we want to focus. We want to focus on the work that you guys are doing with your patients who are military veterans who are terminally ill and all on hospice. So, Carlos, this job position, I hadn't actually ever heard of a hospice veteran liaison. What was the position designed to do, and how did it come about?
Well, it's a position that I initially started at the organization that I ran prior to this. I was vice president of operations for a large for-profit hospice. And prior to that assignment, I ran a program in Northern Virginia. Being a veteran myself and being in a place so close to, Arlington and the seat of government, lots and lots of veterans, and being a passionate veteran myself, I wanted to make sure that we were getting all the benefits to veterans that they were entitled to. So the NHPCO, the National Hospice and Palliative Care Organization, happened to come out with a program around that same time called We Honor Veterans. So we launched a program through them and built it on that scaffolding. And we were able to accomplish the 4-star rating, which at the time was the very highest rating for the programs through NHPCO. So I left that organization and came to Frederick. And I thought about some of the shortcomings of that program. And one of them was the fact that we had volunteers sort of doing that. I wanted to have a full-time staff member available to be able to provide some of these benefits and sort of expand on them, because the program through NHPCO is pretty much limited to veterans that are on your hospice program. I really wanted to extend it out to the community as a whole. So I approached a gentleman who runs the foundation here locally, named Greg Callert. And the Callert Foundation has a sweet spot for veterans issues. His father had been a pilot in the war, in World War II. He was very sympathetic. I explained what my vision was, and he decided to support it. So it gave us the funding that we need to actually staff it with a full-time staff member. In this case, we've changed the model slightly to 2 part-timers, which we feel works a little bit better. There's more flexibility. We're typically dealing with folks that have retired military, potentially having a second job or business. So it makes it difficult for them to devote an entire work week to the endeavor. So it was sort of a compromise of convenience, but it's worked out really, really well. And what I sold Mr. Callard on was the idea that I wanted the veterans program to do 3 things. First was to honor the sacrifice that the veterans had made. You would think that it's not a big deal, but especially as someone approaches end of life and you start taking stock of what you've done, what sort of impact and what sort of legacy you're leaving behind, being recognized for the sacrifices that you've made is extremely important. It means a great deal to the veteran, and even in many ways more so to the families, that legacy is being left behind. So we do a lot of work to honor their sacrifice. We have pinning ceremonies, recognition events. Of course, we're there for the Veterans Day and Memorial Days of the year to provide ceremonies. The second is to help them to navigate the VA system, which, as we all know, can be such a maze and a Rubik's Cube to solve. And many folks just aren't equipped to do it on their own. So our veteran liaisons function to help them through that paperwork shuffle and making sure that everything is submitted properly and that folks are getting all the benefits that they're entitled to. And then lastly, to act as a conduit with other resources in the community related to veterans to make sure that they're made available and made aware of these benefits. So they participate in different veteran organizations and meetings. We have a veteran advisory council that we started here locally to help to drive the direction of our program, but they also serve on other boards throughout the community to help to coordinate services and benefits that are available so that no veteran gets left behind, so to speak.
If you're a caregiver for your dad, brother, or son, you know how exhausting it can be, especially when trying to manage male incontinence. It's very difficult to provide the dignity and comfort he deserves. Let us introduce you to the Quick Change Wrap. It's an incontinence wrap that is effective, convenient, and will change the way you provide care to your male patient, for the better. The Quick Change Wrap folds around the source of urine and wicks it away, protecting surrounding skin, clothing, and bedding. If you're a single caregiver, you'll be able to change the wrap by yourself with no lifting or turning. There's hardly any disruption to your male patient. In fact, he doesn't even have to be awake. It takes just a minute or 2 for one person to change the Quick Change Wrap regardless of size, anatomy, or weight of the patient. Use the Quick Change by itself or with an adult diaper for superior protection. 800 hospitals use it. Now you can get it at home. Visit quickchange.com now. The Heart of Hospice is excited to connect you with Odonata Care. The owners and founders, Nancy Hireman and Brenda Kazire, are experts in end-of-life care with over 40 years combined experience as certified hospice and palliative nurses. They are the hospice care queens. Odonata's mission is to transform the end-of-life experience through education and support. Their 32-page booklet, The Care Plan, A Path to Comfort for the Hospice Patient, empowers patients and their caregivers with valuable information that can be accessed anytime, day or night. Care also offers a suite of 50 free YouTube videos that teach both bedside care for the public and caregivers, and train professionals new to the practice of hospice. Care wants to support every patient admitted to hospice care. Their bottom line is caring for the patient, and that's why their motto is, "Care is treatment." Purchase copies of The Care Plan for yourself or your hospice agency at thecareplan.net. Now, back to today's episode.
One in every 4 hospice patients across the United States is a U.S. military veteran. So there was definitely a need, and then you've been able to expand it and take it out into the community, which leads us to your story, Eric, because you have a unique perspective. You are a U.S. military veteran. Eric, tell us more about the responsibilities of the liaison and what you do from day to day.
As you can imagine, it's a little very day to day, but usually it starts with finding out, do we have any new veterans on census? Did anybody get admitted? Is there any future admissions? Let's walk you through from the time somebody's admitted till we do the honor ceremony. So the first thing we're going to do is we're going to reach out, introduce ourselves to the family, ask if they feel that the veteran would be interested in being honored, explaining what that means. It's typically a brief ceremony, 15, 20 minutes. I like to give and I believe my partner Bob does the same thing, give the veteran an opportunity to share, hey, do you have any favorite stories? Do you have anything you want to share? From my perspective, as I served 20 years, and I don't know that I talk very much about my service. And I'm sure other veterans, it's not an uncommon thing, right? I mean, at my age now, more than half of my adult life was spent in the military, yet I never bring it up. For a lot of reasons, mostly because I just don't think civilians get it. When you get 2 veterans together, you can't shut us up. And so giving that veteran the opportunity just to share if they feel like sharing, whatever. It's really rewarding for both of us. And a lot of times the family will say, I had no idea, and it's really cool. To me, it's really cool.
So the families are hearing these stories for the first time too.
Sometimes.
Yeah. Awesome.
Yeah, it's funny. We participate with the Veteran History Project that records firsthand, veteran experiences, and those are housed in the Library of Congress. And we've done it on several occasions, and had family members come up to us afterwards to say, "Oh my God, I had no idea that Grandpa did that. He had never mentioned it. He'd never talked about it." And again, it's as Eric mentioned, as veterans, we don't really talk about our experiences unless you're talking to someone else who's sort of walked in your boots.
Yeah.
And then you, like you said, you can't shut us up where we start exchanging war stories, and you've got that shared experience. Even if he weren't in combat, the stuff you went through in basic and all the hardships, it bonds you together. And that's why I thought it was so important to have a veteran in this role. It wouldn't be the same just to have a nurse or some layperson acting as a veteran liaison in the community who didn't necessarily understand what the veteran had gone through, because I knew that the veteran really wasn't going to open up to him and share that same way.
Sure. There's a brotherhood that unites military vets. I've seen it with my son-in-law. He served in Afghanistan in the Marines, and there is a special camaraderie that comes with that. It's an amazing bond, and it's very strong, but I can understand there must be a lot of isolation for these guys that haven't been able to tell their stories, because when it comes to the special needs of veterans at end of life, they have different needs. And it also depends on what era they served, what military campaign they were involved in. For instance, Korean veterans and Vietnam veterans. The Vietnam veterans, they've got a lot of angst and a lot of different needs. Carlos, what do you see when it comes to that liaison position? What are the special needs that you see among the veterans that you guys are serving in your community?
It's really a mixed bag. As you said, it really depends on where they served, when they served. We've almost exhausted the World War II veteran generation. As we know, it wasn't that long ago since the last World War I veteran passed away. It's maybe 10, 15 years since that occurred. And we're running very low on the number of World War II vets. The majority of our vets right now are either Korean War or Vietnam era. And I think we see not that I have a great point of comparison because our experience with the World War II vets was less, but there seems to be more trauma, more traumatic experiences that they're dealing with, a little bit more PTSD. We are starting to see a trickle of patients coming in from the Gulf Wars as well, but we're still kind of early in that phase. Most of our patients tend to be over 60 years of age, so that sort of gives you an idea of the sort of patients that we're seeing and the veteran generations that we're talking about. But it's a mixed bag. Their circumstances are all different. Their living conditions are all different. It's very similar to any other, hospice patient that I'm sure you have experience with. There are no two alike. Their circumstances are all very, very different. You might walk into a home and everything is, ready for inspection, so to speak, and ship shape. And then you walk into the next home and they're hoarders. And, you have to hire staff just to clean out a room so you can get a hospital bed in. It's a really mixed bag, but perhaps Eric can share some other experiences with you.
I can say that there have been, and I've only been with hospice since, December. So, I have a limited window of experience. But I've personally had one individual tell me he didn't want to be honored because of the way he was received when he came home from Vietnam. And that bothered me. I thought that was really unfortunate. I can understand it. I mean, from what I've heard anecdotally about how people have been treated when they got back, but it just seemed like a shame that he was still carrying that with him. And then I've had other people that very self-deprecating. I had an individual who got drafted. I think he said he was drafted, but then he said he didn't feel like he deserved to be honored because all he did during the war was play baseball in England. I'm like, so I don't think he was. I think he actually volunteered because I remember saying, you didn't know what you were going to get. You got lucky. I mean, they found you in boot camp or whatever, found out you could play baseball, and they sing in England. We should all be so lucky, but you still signed the line and put your life on the line. You could have just easily been in the jungle. Just luck of the draw. But a common theme among veterans that whether they're in hospice or not is, we don't want to get support, or we don't need the support, give it to somebody else who needs it more than us. That same self-sacrificing kind of thing. And I'm also finding a lot of veterans who still don't know about the PACT Act, which is Congress passed that bill opening up a lot of illnesses and diseases to be presumptive conditions with the VA, so because of Agent Orange. So a lot of cancers, if you're diagnosed with certain cancers, you become eligible for VA benefits because they presume that if you were in Vietnam during a certain year period, then you were probably exposed to Agent Orange, more likely than not. So they're going to give you benefits, and so we're trying to get the word out about that as well, and because it's a big benefit for families. And I went a little off the rails there. Sorry, Helen. No,
that's part of your advocacy. That's awesome.
Helen, I also wanted to add that another component of the veteran program that it really harkens back to the initial program that we established through NHPCO. That framework is a requirement to train. So our veteran liaisons do a lot of training for our own staff. Just as an example, depending on how the death certificate is written for veterans, it can qualify or disqualify them for certain benefits. So they've been instrumental in teaching our clinical staff. Perhaps Eric can speak to this a little bit more depth, but if there's a particular presentation or a disease that would qualify them, and something that they had, it needs to be mentioned in a certain way during the death cert in order to meet those criteria.
Yeah, so a good example, a real example would be, I don't know the right term but I think it's like a comorbidity or something. It's not necessarily the terminal disease, but it's one of the co-occurring diseases.
Yes,
would be arteriosclerosis or some kind of heart disease. And again, I'm obviously not medical. I mean, I was an electrician in the Navy, so I'm about as far from medical as you can get.
You got it right.
But if somebody has that co-presenting and they're in Vietnam era and they were brown water Navy, meaning you're on a riverboat or, you're in the jungles or even in a carrier off the coast, then, as long as that's listed as a contributing factor or the cause of death, your spouse could be eligible for dependency indemnity compensation, meaning should get paid, or he would get paid for the rest of their life. And if you have a disabled child, the child could get benefits for the rest of the child's life. You're getting the same thing with Camp Lejeune for people that were exposed in the water during the 80s. And, for the veterans of the Gulf War, right, you have a lot of the burn pits. So, an example would be melanoma. I had a, and this is front of mind for me because I had a stage 2 melanoma removed from my face for so if I had died of that, it would be presumptive that because of where I served, that caused my melanoma, and which caused my death, which means my family would get benefits, to oversimplify it.
Well, it's super important then that as the veteran liaison at your agency, you're part of the interdisciplinary team. So you are training and supporting the clinicians on the team so that documentation is appropriate and accurate and robust. It just goes to show you how well interdisciplinary teams work and why they're so vital to the work that we do for our patients. One of the things that you touched on was talking to the caregivers, to the families, and I wanted to dive into that a little bit. So we know that veterans have special needs at end of life, right? They're dealing with guilt. They're dealing with anger sometimes, regrets, secrecy, things that they've kept to themselves, survivor's guilt when they came back and buddies didn't. But when it comes to their caregiving systems, to the families that are taking care of them, what do you think is different about the needs of a family or a unit that's taking care of a military vet? Carlos, what would your thoughts be about that?
Again, I think it also varies from veteran to veteran. I think that these folks are real heroes as well. They've given up so much in support of their loved ones. They may have never put on the uniform, but they're really part of the service themselves. They typically are very selfless folks as well. They know that it's their responsibility to take care of the veteran, and often they're not really aware of benefits that they're entitled to for support. And our veteran liaisons are really integral in helping them to understand what's available, things like aid and attendance, for example, to help support them. But they're a group that doesn't complain much, honestly. I'm always very impressed by the caregivers of our veterans, and they don't really understand the toll that it's taking on their own lives. Even after the veteran is gone, we continue to care for veterans just as we do for any of our patients for at least 13 months after the veteran passes. But some of the programs that we have through the Veteran Liaison program are different than what you might see in other hospices, and that we're helping them to follow up with these benefits that otherwise they wouldn't be entitled to.
That must be such a relief for them. I can imagine these are folks like the gentleman that you were referring to, Eric, who said, I didn't really do anything. I played baseball, but yet he was halfway across the world. He was separated from his family. It's an unpredictable assignment. You never know where you're going to be going, and you serve at the discretion of whoever's in charge of you. So a family who has sacrificed those relationships and that time with their loved one who's a veteran, that in and of itself, like you're saying, Carlos, is a sacrifice too. So Eric, how do you support the caregivers? Because I know you've got the resources, but you've got the heart too. You have this experience yourself. What's your personal approach when it comes to supporting caregivers?
I'm laughing a little bit because, I got a degree in social work to try to be squishier. And I'm not sure it took.
That's awesome. I've never heard it described that way, but that's perfect.
It's a technical term.
It's very technical, yes.
So, because I find examples to be a little easier to paint pictures with, I'm going to talk about the Marine I visited with yesterday. He and his wife have been married 42 years. Fantastic. And he and I, this is an example of veterans, you get us together, we don't shut up. We were comparing our time in Gitmo. So he was in Guantanamo Bay in the 50s, and I was in Guantanamo Bay a little more recently than that. Back in, I left Gitmo in 2010. so we ended up having a half hour, 40-minute chat about Gitmo and stuff. And then we talked, I took his wife aside because her husband is enrolled in VA healthcare. He is eligible for home health aides up to 10 or 12 hours a week to get support. And she had mentioned that she was hiring private caregivers. And I said, well, why don't you reach out to the VA through the social worker? And all the social worker has to do, because your husband's already enrolled in VA healthcare, is put the order in, and you can look at maybe getting some of that support you need covered and paid for by the VA. It's one of the things you're entitled to. Carlos mentioned aid and attendance, veterans pension, survivor pension, aid and attendance, housebound. All of those are harder to get because they're going to be income-based, asset-based. So not every veteran's going to qualify for that. But if a veteran is enrolled in healthcare, VA healthcare, whether they're actively seeing a doctor or not, because of the different tiers that they have, you can apply for home health aid, and I really encourage that, because it is, as Carlos pointed out, it takes a toll on being a caregiver.
It does. Do you find that a lot of the caregivers really do say, no, we got this. I've been doing this for so long. I'm used to the work, not realizing how heavy a burden it is?
I haven't gotten pushback like that. A lot of times, unfortunately, because they were not able to get the home health aid because the veteran isn't enrolled in healthcare yet. And by the time we need to get them enrolled, they're too sick to be seen by a physician, or the process just takes too long. But I haven't really had any families push back and say, we don't need the help.
I see the pushback coming much earlier, and it's just around the conversation about hospice care in general. Folks don't understand what it is. They're coming to hospice far too late.
Right.
As Eric was mentioning, which makes, getting benefits, some of the benefits to the VA, if you're not already registered, much more difficult. But in general, it's that, I don't want to, give mom or dad up or my husband up. I want to take care of them myself. Not understanding that hospice is just there in addition to the care, and that we're not taking them anywhere, that we're providing care in the home. So that tends to be a theme that we see across the board through hospice, not just specifically involving veterans.
Yeah. And of course, our length of stay is so short. We don't have time to get in there and apply for the resources and dig in deep like we really would want to, the way that's most effective when hospice is done at its best.
Yeah, it's a constant educational challenge for us, and that's one of the benefits I see of the veteran program, is that it's just another avenue for us to really highlight what we do, not only for veteran patients but for families, because we care for the family group as a whole, not just the patient, and it shows that we really dedicate a lot of effort to the living, and we're not about people dying. People are going to die with or without us. We're here to make life better for those that are left behind in many cases. I want to highlight one particular segment, or minorities. It's very, very challenging to get minorities to participate in hospice care. Nationally, if you look at the numbers, the participation rates are very low, much lower than white Americans. And there are a lot of reasons for that, but we're constantly trying to find ways to break through, not only to the African American community, but Latino community and Asians, to educate them about what the services are, so they can take advantage of them. And I think in some respects, the Veterans Program has helped us in those segments of the community to sort of bridge that gap a little more effectively.
That's awesome. I think it's something like a 30% discrepancy, 20% discrepancy between white Americans that engage and utilize hospice and for people of color that utilize hospice. There's a big gap.
Yeah.
Okay, so here's my favorite question of all the questions that I had listed for you guys. On your wish list for end-of-life care for military veterans, what would be the pie in the sky, whatever you could possibly imagine? Eric, what would be on your wish list for end-of-life care for military veterans?
Well, having only been with hospice for a few months and just seeing the burden on children and spouses, I would love to see VA home health care across the board, and just make it, if you're on hospice, presumptive you're going to need home health care. and just grant it and not make you jump through the hoops of getting enrolled in VA healthcare and whatever. I mean, if it's only 10 hours, it's only 10 hours, but it's still 10 hours more than families can afford a lot of times on their own. And it's just a huge lift off of caregivers.
Yeah. Extra caregiver support. That would be amazing. I would like that for everybody that's on hospice. Okay, Carlos, how about you? What would be on your wish list?
Yeah, that would be a pretty big list. But I'll try to highlight, one thing in particular, and that's concomitant care. Many folks are kept away from taking advantage of hospice services because they continue treatments of one form or another. And there have been some insurance companies that have started to move in the direction of allowing for concomitant treatment so you can receive hospice care while still receiving some curative measures. Those have been sort of sporadic efforts. I think in the long run, it's a really smart decision and a good financial decision. Honestly, getting hospice involved early actually it saves the health system a great deal of money because folks are not taking such a big chunk of their care at the end of life. That typically it's care that's not going to lead down the road to a cure, right? It's unnecessary, right. And folks continue to do that because they haven't been exposed to the palliative treatments that we offer in hospice care. So I'd like to see something at least along the lines of patients who with renal disease, who are on dialysis, being able to take advantage of hospice services while they're still on dialysis, which right now it can't happen. They're both Part A benefits, so we're prevented from doing that. But even with the VA system, I don't believe that they'll allow hospice and dialysis to occur at the same time.
Yeah, I think that's on the wish list for almost every hospice professional across the United States. Absolutely. Absolutely. Thank you guys so much for joining me today. I'm so impressed by the work that you're doing, and I want to say thank you on behalf of the hospice industry and all of these end-of-life teams. Keep innovating, keep reaching out to your community, and thank you so much for sharing your message with us today.
Thank you, Helen.
Thank you for giving us the platform, Helen.
As you can see, they both bring a unique perspective because although Eric doesn't have any previous hospice experience and no personal hospice experience, he has his experience as a veteran, which lends him this special perspective that really adds to the skills and gifts that he brings to the care of the patients. And of course, Carlos had not just veteran experience, military experience, he also had the experience of companioning his father at the end of his father's life. So the veteran liaison position, which I had never heard of anything like this before my conversation with these guys, it was created to provide better information and resources to veterans who are on hospice, and they've expanded that out to include veterans programs in their community, which is awesome. The purpose of their veteran program is to not only honor the sacrifice the veterans have made through the pinning ceremonies and recognition events, things like that, but also to help them navigate the VA system. And if you know anybody who is a military vet or you have a veteran in your family, you will know that the veteran system, the VA system, is so challenging when you're trying to make your way through it. They also act as a conduit for other benefits that are available to veterans, and really just to support and make sure they're informed and feel supported at the end of life. Carlos said for him, he felt it was really important to have a veteran to serve in this liaison position. And I think he's absolutely right. As a nurse, I cannot relate to those military experiences, that military history and legacy. I have no perspective on that's relatable. And Eric brings a special connection, that brotherhood bond that's so important for someone who's been involved in an intense, unique experience like military service. The Veteran Liaison also provides assistance to the caregivers, making sure they have the resources that they're qualified for, and then they continue to support them throughout that bereavement period for that 13 months after the death. Just a very robust program, pushing it out into the community. These guys are making a difference in the lives of the military veterans that they serve. If you'd like more information about the Hospice Veteran Liaison position and the work that Frederick Health Hospice is doing in the community, check out their website, frederickhealthhospice.org. Be sure to catch the next episode of the Heart of Hospice podcast. You can find more episodes on theheartofhospice.com. And don't forget to subscribe on your favorite podcast platform. You can connect with the Heart of Hospice on Facebook and Instagram and send your questions or comments by email to helen@theheartofhospice.com. And remember, no matter who you are or where you are in your hospice journey, you are the heart of hospice.
This is the Whole Care Network. Helping you tell your story one podcast at a time.